I am Dr. Abhay Khode, international cardiologist practicing in Pune. Today I am going to tell you about the diabetes and the cardiovascular risk. We are discussing this under the three headings. Why this patient, they are more prone, diabetes patient, they are more prone to get a cardiovascular disease. What are the treatment outcome and what are these outcome of this treatment in the patient with the diabetes. One thing, first I would like to tell you, the diabetes patient, they are more prone to get a cardiovascular disease. Why? Number one, because of this uncontrolled sugar, this patient, they have associated dyslipidemia. They have increase in the coagulation of the blood. That's why this patient, they are more prone to get a thrombosis, and these patients are more prone to get this atherosclerotic plaque. And that's why, because of this increased coagulability, these patients are more prone to develop the coronary artery disease, more extensive and more rapid as compared to the patient, those who have non-diabetic. And the treatment option in this patient, as this patient, they have the extensive coronary artery disease, the stenting, that is the angioplasty that we do, these are the chances of failure or chances of the restenosis or development of the blockages again in these states are more as compared to this non-diabetes patient. So the most of the patient, those who have extensive coronary artery disease, that we offered them to go for this coronary artery bypass surgery. But even then, because of this uncontrolled diabetes, this coronary bypass failure is chances are more as compared to the patient, those who don't have a diabetes. So the key point is that this patient, they are more prone to develop the coronary artery disease, and what we can do is to tight control of this blood sugar. And outcome in the sense that this patient, they are more prone to develop a sudden cardiac death is because of this long-standing diabetes and uncontrolled diabetes, these patients, they develop the small vessel disease, that is the intramyocardial disease, vessel disease, and that's why those who have a long-standing diabetes and uncontrolled diabetes, they develop this cardiomyopathy, that we called it as the diabetic cardiomyopathy, and these patients, they come with the recurrent heart failure. And one more thing, this because of this long-standing diabetes and associated kidney failure and all that things, these patients are more prone to develop this cardiac autonomic neuropathy. And because of this cardiac autonomic neuropathy, these patients are more prone to get this sudden cardiac death, that is because of this ventricular tachycardia, ventricular fibrillation, because this cardiac autonomic neuropathy that leads to the QT interval prolongation, and that leads to the sudden cardiac death. And that's why this diabetes patient, they are more prone to get this coronary artery disease and sudden cardiac death. So the patient who has diagnosed with a diabetes, they should be strict control of this blood sugar level, so that to prevent the further complications like coronary artery disease and sudden cardiac death.